Good evening, Facebook. For those who tune in regularly, I just wanted to say, check it out. We got our logo on the wall finally. So I'm really excited about that. If you're stopping by for the first time or the 7 millionth time, if you don't mind, like this, say hi, maybe comment. I'm going to do a video on shoulder pain. So one question I get a lot is, it just feels like my pain in my shoulders is worse in the winter. And one of the kind of no-brainer solutions or reasons for that is we bundle up and then we walk around like this, especially in Northeast Ohio where it's freezing cold, right? So having your shoulders up like this is not good for you. So relaxing your shoulders, keeping them down and pulled back is going to be one way to kind of help with some of your shoulder pain. But for a lot of people, it goes even deeper than this. Maybe they're sitting more, maybe they're holding a purse and cold. A lot of people are less active and maybe even tend to eat worse in these winter months. We're all low in vitamin D, we're low in zinc and vitamin C. We're getting sick all the time, unless you're like me and my group of healthy living challenge people. All of us are feeling great, have lost weight, and doing awesome and not sick. But I digress. So a lot of times it's that inactivity, that chemical inflammation and stress, and that seated, hunched over posture. So a little bit about that posture. If your hips go on level, if your shoulders go on level, your whole body doesn't want to feel like the leaning tower of you. So what your eyes do is they have something called a writing reflex, not writing, but writing, like upright. And so instead of leaning, your head goes like this, and then you feel like you're straight up even though you're not. And so what that does is compresses that whole side of your neck that you tilt towards. And then, one of the questions I get a lot is, I don't know if I'm just cold, but I can't feel my fingers as well in the winter. They're kind of tingly, they're kind of numb, and I think it's just the weather. I think I just pump my gas without my gloves on, which maybe, but I would imagine it's probably more of some of this neck and shoulder compression. So with that posture of compressed neck, shoulders up by your ears, then you also are potentially putting some pressure on the nerves as they exit the spine, and then tightening up those muscles to hold it that way. And in that way, you can cause numbness and tingling down in your fingertips. Your nerves come out of your spine. They go all the way down your arm into the very tips of your fingers. And so oftentimes when we have numbness or tingling specific to certain fingers, like people say, it's my pinky finger, I can't feel anything on my pinky finger, it's these two fingers. And of course there's another finger that I won't do. But the middle finger also represents a certain spinal level. So this could be coming from that compression in your spine. Could be very specific to one level. You could have a mild disc bulge that has been causing chronic pain. And then you could have also just some muscles, more of a peripheral neuropathy where the muscles are clamping down on the nerves elsewhere and causing strange numbness and tingling. So that could be going on. So now you know why that might be happening. How do you fix it? So the very first thing is to get a chiropractic adjustment. So when your bones are compressed from gravity, rotated, or tilting, like when you look right or left or tilt your head, you look up and down and you have pain, you probably have restriction. You definitely, if you have those pains, you have restriction or subluxation in your spine. So one bone on top of one bone is turned the wrong way, and that can your muscles can kind of clamp down around that and get this almost like a bad muscle memory. So like, again, you feel like you're straight up, but you've been standing like this for years, or you feel like you're sitting up nice and tall, but really this is your go-to posture, which is most people I see. When your posture is like that, your shoulders are rounded forward and your head is forward, it also makes your head feel even heavier. So a lot of people I see, their head feels like it weighs 3 or 4 or 5 times the weight. So instead of 10 pounds, it feels like it weighs 30, 40, or 50 pounds. And I don't know about you, but I'd like to just hold only my head weight whenever possible, right? Because, if you asked me if I wanted to hold a bowling ball here or right here, for an hour, you can bet I want to hold it right here where my center of gravity is, where my rest of my body can help me hold that up. Here's like a really mean workout. I know a couple of trainers who would make me do that. Okay, so those the very best thing is to get an adjustment. Decompress the spine with an adjustment. Take the rotation or the lateral tilting out. It's very gentle, and you're going to feel awesome afterwards. The very second best way is to get a massage or have some manual work done. So specifically, I love our massage therapist, Nori, because she's very therapeutic based. She does a pre and post assessment. She's going to have you look different ways, lean different ways, show you different activities that cause you pain. And then once she fixes it, she's going to have you do it again to prove that you feel better already. And it's so easy to walk away from a treatment going, I don't know if I'm better or not. Well, here you don't do that. You feel better every single time you leave. And if you don't, if you feel a little bit sore, you understand why. But I've shown you that your muscle strength is improving, your muscles are relaxing, and Nori does the same. So another little tool that works really well is 2 different techniques called ART, active release technique. That's where you're going to hold down a muscle and have you move around it. This is great for athletes and for anyone who has like that tight muscle problem, especially in their shoulders up here. And then also Graston, which is a technique where you almost like scrape over the skin to relax the muscles in the same way. And finally, if you do have excessive tingling or numbness, you might have a minor disc bulge in your spine. If you do, the only thing that's really going to treat it very well conservatively is going to be spinal decompression. So get on a spinal decompression bed. It's computerized, and it aims for the exact level where your disc bulges, and it creates a vacuum effect at that level, pulling that disc off of anything it's pressing on, centralizing the jelly in the middle of your disc so that your spine can move and be supple and happy and wonderful. All right, guys, good luck out there. Try to stay warm. It is gross. So I hope you have a great evening. I hope your shoulders are nice and relaxed just thinking about this, and I'll talk soon. Bye.